Healthcare workers may need to have their booster shots in order to keep working in New York State. That was the big news out of Governor Hochul's COVID briefing today. Hochul announced that starting Tuesday, all healthcare workers will need to get a COVID booster within 2 weeks of becoming eligible for one. There will not be a test out option, and only medical exemptions will be allowed. The measure still needs to be approved by the state's Public Health and Planning Council, which Hochul says she is confident will happen.
And so we're the first state in the nation to institute this because this has been such an important priority. We've already seen what's been happening in our healthcare environments. Staff is getting sick, they're leaving. We need them to get well. We need them to have the best fortification they possibly can, and that means getting a booster shot as well.
Hochul said state health leaders are starting to see a potential plateau of the Omicron cases across New York, and there is some cautious optimism that this spike has peaked. And a few other COVID headlines. The state is opening up testing sites at SUNY campuses across the state, including 2 here in Western New York. This one at the Buff State Alumni Center and another at UB Center for Tomorrow are open every weekday by appointment only. We have links to schedule those appointments with this story on WGRZ.com. Well, Erie County says it's going to be sending out 80,000 at-home test kits to towns, villages, and cities tomorrow morning, which will be distributing them to people. You can check your municipality's website and social media for info on getting them, and the county executive says more are coming. And ECMC says a 20-member medical response team from the U.S. military will be arriving there over the weekend. They're expected to help the hospital deal with the surge starting next week.